I'm Dr. Sanchita Dubey. I'm a senior consultant at Apollo Hospital, Noida. So today we will be discussing about the urinary problems in the women. So we all know that women usually almost 60% of the women face some point or the other in their life a urinary problem. So why is it so? We need to understand why women face more urine problem than a male counterpart. The foremost important thing is the urethra is very short in females, so that leads to urinary complaints. Then woman is a person who undergoes a lot of physiological changes during pregnancy and then certain changes after menopause. Now there are two sets of major problems in a woman. One is a urinary infection, the other is the continence. Infection, हम सबको पता है what infections are. You may face burning while passing urine, or you may have frequency of urine. So I am going to give you a few tips to avoid certain facing with urinary problems. One is during summers, a lot of women have a lot of sweating. So then the urine volume is reduced, and that gives the chance of the bacteria to grow more and leads to urine infection. The other symptoms when there is a lot of winter and then you tend to have less of water intake. So finally you need to understand that you need to have at least 2 to 3 liters of water every day to prevent urinary problems. And another important thing is you should be passing urine frequently. Every 3 to 4 hours you should pass urine so that you don't catch up with urine infection. There is one more incidence where a woman usually faces urine problems are after traveling. So what happens, sometimes you don't get a proper place or a proper bathroom to urinate. So then you tend to hold your urine for a long, and secondly you tend to have less of water intake during your travel. So that is also because when we sit with the OPD and the woman is coming to us with any urinary complaints, when we ask them that is there a history of any recent travel, so yes, there is. Almost 60-70% times there is a history of recent travel. So while traveling, you should make sure that you take adequate water. If during the travel you haven't, then once you're back or you have reached your destination, you should start taking extra water and then pass urine, so that even if you have catch up with some mild infection, you can just wash it off with excessive water intake. And the other thing is you have to maintain proper hygiene also. So whenever you get chance, you should wash your private parts after urination. If during travel you are not able to do it, once you're back home, you can start doing that. Then another set of problem is about the stress urinary incontinence or urge urinary incontinence. It is basically leakage of urine. So usually what we have seen in a woman is they accept their problem, and this is a very slow growing problem. And when women talk to each other, everyone says, okay, you also face it? Yes, I also face this urine leak. While passing, while laughing, while having brisk walk, or while just coughing or sneezing. So you tend to trickle some amount of urine, which you accept as a normal part of your life. But it is not so. It can be very well treated. So you have to come up with your problem, discuss it with your doctor, and look for the solution. Now there are two types of leakage. One is when you are holding your urine, and when you want to pass urine, you're just not able to control it, and you just have to rush in, and while rushing in looking for the place to pass urine, you just leak a little bit. So that is called urge incontinence. The more common causes for urge incontinence may be during pregnancy, if you are too overweight or obese. It is age-related changes also, and just post-delivery, you tend to lose your pelvic muscles. And if you are used to taking too much of caffeine, that also leads to urge incontinence at times. And at times it is related with the urine infection also. So when you have oversensitivity because of the infection, you tend to have urge incontinence. That means when you are about to go and pass urine, you leak a little bit of urine. So very simple things which you need to practice for that is, there are two main sets of duration in your life where you are prone to catch up with this urine infection or urine incontinence. One is during pregnancy or just after your delivery, and the other time is after menopause, because these are the two times where your pelvic muscles tend to get lax and the holding capacity goes down. So we often advise our patients for Kegel exercises, that is called the pelvic floor exercises, which is very important during pregnancy, post-delivery, and in a postmenopausal age group. Now, another is stress incontinence, where you suddenly cough, you trickle out your urine, or you laugh loud, then you trickle out. So at times, it is very, very embarrassing for a woman. And often I have heard a female coming to me and saying, "Doctor, I have just stopped going to any parties, and I am just not comfortable going out for holidays and all, because I don't feel comfortable with this amount of urine leak." Or at times they need to carry a diaper with them to avoid the embarrassment. So here I would like to emphasize that, see, there is a solution for everything. So the first thing is, you need to just practice certain precautions. Like post-delivery, you should always go for regular pelvic floor exercises. You should come out with this question with your doctor and discuss about it. The other thing is, like chronic cough, constipation, or lifting too much of weight also tend to increase this problem. So you should take precautions in that. While lifting weight and all, you should practice ergonomics so that you don't put a pressure on your pelvic muscles. The other thing is, if you're having constipation for a very long period, you should take treatment for that and get it rectified as early as possible. The other is chronic cough. So that also you need to work on, so that that doesn't keep on affecting your pelvic muscles to the extent that you start facing this leakage of urine. All right, so there is a very latest therapy which is available. There are multiple procedures for it, and there is a non-operative laser mechanism which helps in strengthening the pelvic floor muscles. Plus, it acts on the vaginal mucosa also. See, we all know that why females after delivery and after menopause face this urinary problem, because bladder is just in front of the vagina and the uterus. So if there is any hormonal changes which are leading to laxity in the vagina, that leads to urine leak also, because the support of the vagina is affected. So that is how a woman faces urine incontinence. So we should always encourage our women to come up with the problem so that that can be settled. A few years back, there was only either the medication or the surgery which was available. So now what I want to highlight here is, there are non-operative laser therapy which can correct your stress, leakage of urine, or urge incontinence. There are multiple uses for this also, but here we will be concentrating only the urinary problem. Now, at the end, I would like to just emphasize that what woman should question herself, that you should not, accept that, okay, this is a problem, I have to live with this problem. Now, you should start questioning yourself. How often do you experience a sudden, strong urge to urinate? If this is once or twice in a day where there's been a very long gap that you haven't passed urine, then it's still acceptable. But yes, if you feel that after every hour or so you feel this strong urge, that means you should question yourself and you should approach approach to your gynecologist that probably there is weakness in my pelvic floor muscles and I need to be examined and treated accordingly. The other question which you should ask yourself is, do you experience any pain or discomfort while urinating? Yes, so pain and discomfort while urinating may be a sign of urine infection. So you should not ignore this, because at times if there is an infection which is for a very long period, then it may start affecting your kidneys if there is too prolonged an infection. The other question which you should ask yourself is, do you feel like not able to empty your bladder completely after urination? See, what does this question means? This means that sometimes, the women come and they say, I have a frequency of passing urine. So we next question them, do you feel this urge of going back and passing urine the moment you have passed urine? So they say yes. So that again is a sign of some laxity in the vagina, because when you go and pass urine, you may not be able to empty out your bladder completely. The other cause for this is definitely you need to see a gynecologist and get yourself examined, because sometimes there are some tumor in the uterus which is giving a pressure over the bladder, and that leads to the sensation of passing urine, though you don't have a volume to pass, but yes, it also requires an examination. Have you noticed any blood in your urine? Yes, that is alarming. So don't worry. The blood while passing urine is the first sign of infection. This is nothing to do with any cancer or something. But yes, you need to be examined if you have any blood in your urine. So you don't panic. You can go and see your doctor, but in the meanwhile, you can just improve your water intake. So when you improve your water intake, some mild infection can just be treated on its own. And then once you visit your doctor, the test will be done and then you'll be treated accordingly. Have you ever had a recent urinary infection? Okay, so there are women who have a tendency of catching up with urine infection. So don't just accept that fact that, okay, yes, I have a tendency. So whenever I travel, I catch up with infection, or even some women catch up infection after intercourse also. So don't accept it and just, live with it. So you have to practice two basic things. You start doing your Kegels exercise, pelvic floor exercises. So probably there must be some cause of concern, like there will be laxity, which may lead to frequent urination. And if your urine is not being emptied completely, so there's some amount of urine which is always there, which the bacteria in the urine gets the chance to multiply if they are being retained there for a very long period. So these are the common questions which you should be asking yourself and get itself examined and rectified. So at the end, what I would like to emphasize is, one, you need to practice a good hygiene for your private parts. And another thing is, you should have a habit of having at least 2 to 3 liters of water during every season. Be it summer, you just increase some more amount of water intake because you're sweating. The other is during winters also you should maintain your hydration, because you don't get thirsty and then you tend to have less of water intake. And the most important, which I would like to emphasize, is about the urine leakage, which almost, when I have started questioning the women about their problem, so it's almost 30 to 40% of the women who face leakage of urine post-delivery and in the postmenopausal period. So you should know that all these things are treatable and you just don't have to live with it. So all the very best, and you can question whatever can be answered.